John, this is one of 3 centres across Rhondda Cynon Taf that will be carrying out mass vaccinations. There will be centres like this across all local authorities in Wales, all local health board areas. Now, Wales is set to get 4.8% of the total number of vaccine doses that the UK has ordered in the first phase. That works out at 40,000 doses. It is a 2-stage process, so that means 20,000 people will be getting this vaccination first of all. It is just a start, but it is a significant one. In Mountain Ash today, a sign of something brighter on the way. Valleys communities like this have been hit hardest by COVID. The approval of a vaccine is a glimmer of hope, said the First Minister at the end of a dark tunnel. But in the queue for the post office, some still struggle to see the light. What do you make of this COVID vaccine news? It's good news?
A lot of rubbish, isn't it?
Sorry?
A lot of rubbish.
Yeah, why do you say that?
Don't think it'll work.
You don't think it'll work?
Nah.
I wouldn't have it personally.
Why not?
Well, I wouldn't want to be a guinea pig, so no.
It's a sign of hope, isn't it?
Sign of hope?
Yes. This virus takes no prisoners, does it? And particularly with the elderly, where they're very vulnerable.
At the local indoor bowls club, a mass testing centre was being signed off today, but it's hoped it won't be testing for long.
Although 2 metres is fine, you just keep the distance, it just makes it a whole lot easier.
These booths are set up for the lateral flow testing now, starting this weekend, but this then will be converted into individual pods. So we will be ready, certainly by Christmas, so as soon as we are told it can be rolled out to the masses, we will be ready to go. RCT has probably had the highest rate of deaths actually in now the whole of the UK. So in terms of encouraging people to make sure they do get a vaccine, now it's been approved as being safe, is going to be really key to us. We really need to make sure that the masses turn up when it is offered. And we need to also dispel the rumours about the vaccination not being safe and not going through various checks. That just isn't the case.
One of the biggest challenges with this vaccine is keeping it super cool. It needs to be stored at temperatures as low as minus 75 degrees. It'll be transported here in refrigerated vehicles, kept in freezers over here before being transferred into cool boxes and then given to people over here. It means, though, that there is a limited time between that vaccine coming out of the freezer and being put into people's arms.
We have never in the UK, certainly in my professional career, and probably ever, undertaken a mass vaccination programme of this nature where our ambition is to eventually reach the whole population. That is clearly not going to happen overnight. This is going to be well into next year before we get through this. And that reflects the fact that we need to have access to stocks and, of course, the logistics of managing something on that scale are absolutely enormous.
Official advice recommends the vaccine be offered to care home residents and health and social care workers first. But today the Welsh Government admitted that because of the logistical challenges, the vaccine can't be delivered to care homes. Despite that, however, the Care Forum Wales sees today as a breakthrough moment.
To be able to get this vaccine to the care home staff is a great step in the right direction, and that we hope will commence very, very soon. So that is really, really good news.
In the drive to beat COVID, today marks a significant score against a formidable opponent. But it will be many months before we can claim to have truly beaten this virus. Now, we talked a lot there, didn't we, about the logistics involved. Just getting this together is a pretty big logistical challenge. All day they've been putting up tables, putting up these various screens and booths. Now, all this is for mass testing, as I said in my piece, but all this is going to have to be taken out and bigger pods put in. Of course, if you've got pods, you've got nurses, for example, people administering the injection. The Welsh Ambulance Service are going to be setting up over, I don't know if Gareth can move the camera slightly, where the ambulance service will be setting up over in this corner here to provide extra support as well. So there's still lots of logistical challenges to be getting on with. Now, as far as the dose regime, this is a 2-dose regime, so you basically get 1 jab and then a month later, 4 weeks later, you get a second jab. Now, you have some protection from COVID after the first jab, but you don't get full protection until 7 days after the second jab. But there is obviously still a need for people to maintain social distancing and things like that. This idea of herd immunity, when you vaccinate a lot of a population, does not become a factor until many, many months down the road. So the message from authorities is to continue to wear masks, wash hands, keep your distance.
James, it's good to see things getting underway where you are. And fair to say a mixed and perhaps surprising reaction from some of the people in Mountain Ash today.
That's right, John. A very much mixed reaction. Plenty of people are willing to have the vaccine, but a considerable number of people unsure whether it's for them. Bearing in mind this is a part of Wales that's had some of the highest COVID rates, the highest death rates in the whole of the country, and indeed in the whole of the UK, it might be natural to think people would be quite keen to take up this vaccine. However, one of the biggest challenges that authorities are going to have over the coming weeks and months is gaining that trust from the population, getting people to understand how this vaccine has come about so quickly, how it's been produced and how safe it is. That'll be the challenge on the tables of many decision makers here in local authority level, at health board level and indeed at Welsh Government and Westminster Government level.
OK, James Crichton-Smith in Mountain Ash, thank you very much indeed.